Hi everyone, my name is Alyssa Maraia, and today I'm going to be presenting to you my practice evaluation project, which is going to be looking at symptoms of burnout and really taking a cognitive and behavioral therapeutic approach to managing these symptoms. I am going to be referring to myself as the client throughout this presentation and will include some possible observations a clinician could notice as I'm speaking to them and in treatment with them. To get a little information about the client, we see here that it is a 23-year-old white female. She's in her final semester of graduate school, works full-time while also being in school full-time. She is single and has no children, has a previous diagnosis of major depressive disorder and generalized anxiety disorder, and is coming to treatment with high levels of stress, really resulting from possible burnout due to work and school overload. Taking a look at the problem, we see that the client reports that she's been working full-time and getting her master's in social work full-time since May of 2023. She has reported an increase in stress over the past 3 months, which has looked like taking multiple sick days from work, being more tired than she normally is, not being able to sleep as well, and really developing procrastination as this new behavior, which is something she never really presented with in high school, college, and all of her other previous educations. She also identifies feeling uncertain about her career choice, reporting that she doesn't really think she's going to be any good at it. As I mentioned earlier, I'm going to talk about some possible clinician observations that could be noted. I could imagine that I would appear very anxious, maybe some shakiness in my voice, picking at my fingernails, which is a major symptom of my anxiety. And kind of having some disconnected statements. So reporting being scared that I'm not going to be good at it, but then also understanding that it takes a while to become competent and confident and comfortable within the field. So overall, the problems described by this client are not really wanting to go to work anymore, kind of wanting to drop out of master's program because it's too much, and not really actually knowing if this is what she wants to do. Feeling exhausted and drained, and really just wanting to stop procrastinating to really get through this final semester. So based on all of these identified problems, we've come up with the following problem statement. So stress related to both academic course load and job workload is decreasing motivation to complete coursework, leading to increased levels of procrastination and stress, leading the client to frequently feel exhausted and drained, and to experience depressive symptoms such as this lack of motivation, increased tiredness, and missing work. Here we're going to have 2 outcome goals. The first one being that the client will increase their understanding of stress and burnout and how that can impact school and work life. And the second one being that the client will decrease overall levels of stress within both school and work life. Taking a look at theory here, considering that she's been getting her master's full-time and working full-time, and is really reporting this recent development of procrastination, I really think it would be appropriate to look at the relationship between both her cognitions and behavior to really look at decreasing these negative feelings associated with this overload. I would also be interested in incorporating a solution-focused behavioral approach to allow for some goal setting and more of a task-oriented approach to really look at decreasing these overwhelming feelings that she seems to be experiencing a lot of. So overall, the hypothesis here would be that improving cognitive patterns and increasing the use of identifying tasks will decrease procrastination and overall feelings of stress within the client. The interventions that are going to be used in this self-study include cognitive restructuring techniques. These are really going to be used to challenge beliefs that assignments are too overwhelming. So these are going to be these maladaptive and harmful beliefs that kind of allow for the client to really push off these assignments. These thought processes that the client has will able to be further explored in treatment, as the client is going to be required to write down these specific thought processes in a behavioral log that we will actually be discussing in a little bit. Stress management and relaxation techniques will also be discussed in treatment. So the client will be able to identify useful and effective strategies that she can use regularly and ideally practice daily throughout the intervention phase. Lastly, solution-focused techniques are really going to aim to break tasks down into more manageable pieces. And this approach here is really going to look at decreasing these overwhelming feelings, as assignments are going to be broken down into smaller pieces. So this big 10-page paper that she has due at the end of the week is maybe going to look more like writing 2 pages one night, doing some research another night, and really just breaking that down further. This client's going to have 3 process goals. For the first one, the client is going to address behaviors, so in this case, procrastination, that are driven by these negative thought patterns, so like this paper's so big, by breaking at least one assignment down each week into more manageable pieces and more manageable and achievable pieces. The second one is that the client's going to be able to identify the cognitions that lead to procrastination and the increased stress. And the third one is that the client will utilize at least one stress or relaxation technique daily to decrease feelings of stress. Before getting into the literature, I really want to look at work burnout. So the American Psychological Association defined workplace burnout as the result of ongoing stress at work that had not been managed effectively. So this is a syndrome, and it involves ongoing mental exhaustion, this psychological distance, some like overall negativity, and this feeling of inefficacy in what they're doing. A research series on employee mental health back in 2024 surveyed 1,405 employees within the United States, and this survey showed that 44% of employees felt burnt out, 51% felt used up by the end of their workday, and 45% felt drained emotionally. And these statistics are really going to be highlighted again later on in this presentation as we kind of look at the implications of what this research is going to allow for us with future clients. Taking a look at our first scholarly article here, this was a systematic review of prospective studies on physical, psychological, and occupational consequences of job burnout. So in this study, we saw that burnout was a significant predictor of several physical issues. So we had type 2 diabetes, gastrointestinal problems. There's also psychological issues such as insomnia and depression, and then occupational issues as well. So absenteeism from work and overall job dissatisfaction. When I was using a critique of a systematic review, I did find several strengths of this study, which were it had a clear rationale and it was highly relevant to the field. It also drew from multiple domains to collect their research, and it used a prospective study design, which really it kind of showed this comprehensive approach that these researchers took, and seeing this approach and seeing these strengths really helped me to increase my trust in like the validity and reliability of the articles overall. Looking at the weaknesses using the same critique, there was a lack of information regarding how they selected the studies. There also is not a formal tool used to assess for bias in the selection process. So this kind of just points at remaining cautious when we're interpreting these results because biases are apparent in all studies. So there were most likely biases in the selection process, so just kind of remaining aware of that. This study was published in the PLOS ONE journal, so this is a science and medical field journal. So again, we need to be cautious when interpreting this information because this research is being published for so many other disciplines, so we do need to remain cautious. Articles were also primarily selected from European countries. And there was not much discussion on power, privilege, diversity. But because of the limited research that there really was on burnout in the field, I felt comfortable and confident using this article because it gave me a really good sense of what does exist for the current research and what symptoms do look like. The second article that I used was a randomized control trial. And this was on mindfulness-based social work and self-care with social workers. So this study included 62 participants, and it really looked at the effects of a 6-week online program. This program is called the Mindfulness-Based Social Work and Self-Care. And this is really for managing burnout, depression, well-being, anxiety, and stress, specifically in social workers. So very relevant to the client. The study did show that this program was significantly more effective in improving the emotional exhaustion, depression, and anxiety and stress in participants compared to an active control group. There was also some additional improvements in attachment, acceptance, worry, and mindfulness practice. So it really did show some positive results. Using a critique of randomized control studies, I did find some strengths in this article, a very clear and defined intervention. They explicitly stated the primary and secondary outcomes. The results were interpreted in very simple and applicable and easy to understand language. So this really did show that it was a very high quality study. And in actuality, using this same critique to look at some weaknesses, I really did struggle finding any weaknesses. The one thing I did note was that the study did not identify any type of blinding that they used, but the critique did say that that was not a necessary piece of information to include. So overall, I do feel that this randomized control trial was extremely useful and beneficial and very valid and reliable throughout this research. The study was published in Current Psychology, which again indicates a lot of relevance to the field of social work. And it really just offered some very valuable information as it specifically looked at social workers in the field, which again is an area that is researched very little information on. So being able to have a control study that, a randomized control study that specifically looked at the population of the client was very beneficial. So this third article that I looked at is a qualitative article, and it was really looking at a new stress context vulnerability model. And this model was looking to explain how stressful situations do increase the risk of procrastination in people. And this is really seen because the person's ability to cope is really being taken away, and their ability to kind of tolerate and manage these negative emotions that they're having associated with this stress is significantly reduced. So this model was used and kind of explained how future interventions can be aimed at reducing procrastination overall. And again, using critiques of qualitative articles, the strengths of this study were that there was a clearly conceptualized aim, the research question was clear. There was also a very good description of the practical importance of this article, which sometimes I feel like can be overlooked in certain qualitative articles. It could maybe seem like a little bit of a stretch, but I felt like this one was clear and to the point. Weaknesses of this review, there was a limited qualitative methodology. There's an absence of data collected from participants in previous studies looking at this model. And that's really just because this is a conceptual review, so that is to be expected. This article was published in the International Journal of Environmental Research and Public Health. So although this article is applicable and relevant to the client, it again should be looked at carefully because it does pertain to several other disciplines. But again, there is really limited research in this field looking at burnout, procrastination, stress, and kind of all of these different ideas. So this article does offer some very beneficial information to really help clinicians increase their understanding of what exactly the client is presenting with and why. So this study used a single system A/B design. This was really chosen due to time constraints. And because this was a self-study, that really just was one of the easiest ways to collect the data. Ideally, I would have liked to have been able to do an ABA to really kind of get more of that, more of those outcomes, but just due to time constraints, I unfortunately was not able to do that. Looking at the measures used in this study, Maslach's burnout inventory was used to measure the risk for burnout. This scale really looks at 3 different components of burnout. So we have depersonalization, emotional exhaustion, and personal achievement. Questions within this scale are including these 3 different components, and they're also a self-report scale. So they increase in symptom severity starting from 0, never experiencing these symptoms, to 6, which is experiencing these symptoms every day. And some example questions are going to be included in the next few slides as well. The next measure that was used is the daily stress related to schoolwork independent rating scale. So this scale was created in order to really look at the client's unique symptoms and kind of measure how she experiences those, like her exact symptoms specifically, instead of just using kind of like a generic scale. This is again going to be self-report. It's going to be on a scale from 1 to 5, 1 of no stress, and then 5 is very stressed. Lastly, a behavior and thought journal will be kept by the client, and this is ideally going to be completed daily. This is going to measure what the client was doing when they realized they were procrastinating on an assignment. So were they at work? Were they eating? Were they with friends? Really just kind of taking a look at that. The thoughts that were associated with that procrastination and how they respond to it. So ideally, this response is going to be the use of an intervention. And kind of just look at the shift in thought processes after using that intervention. So here you can see the daily stress related to schoolwork independent rating scale. Again, this is 1 through 5, so 1 being no stress and kind of some examples of what that might look like. 2, very little stress. 3, somewhat stressed. 4, moderately stressed. And 5, very stressed. Here we have the Maslow burnout inventory. So as you can see, this is an example of section A. So for example, I feel emotionally drained by my work. Working with people all day long requires a great deal of effort. I feel like my work is breaking me down. And again, this is from 0 to 6. So 0, never, 1 a few times, all the way up to 6 every day. And then lastly, we have the behaviors and thoughts and emotions journal. So this is really just going to look at what I was doing when I noticed I was procrastinating, my thoughts, feelings, and kind of behaviors that were involved. And then I'm going to specify an intervention that I use. This will be one of the interventions that are really just learned in treatment. And then I'm also going to identify any changes to my thoughts, behaviors, or feelings after I complete the intervention. So the MBI was chosen because it is the most reliable and valid form of assessing burnout. It's actually considered the gold standard. It's a standardized scale, so it can really get this information that we need systematically. We're able to compare it to a normative population. It's feasible, it's available, it's time efficient. So there's a lot of these strengths associated with a standardized scale. Some disadvantages, though, are that the researcher is required to interpret these results cautiously. So yes, it does give you a score, but you do really want to interpret those carefully and kind of use it as a way to collaborate further with the client instead of diagnose them. The daily stress related to schoolwork independent rating scale was chosen just to kind of measure the symptoms of the client specifically. As an independent rating scale, the client is easily able to complete it regularly. It doesn't cost anything, it's reliable, it's valid, and it is sensitive to change, which is an important component. There are disadvantages. There is a normative population you can compare it to. But I would like to note that I don't really think that this is necessary in this situation, as this client is really just trying to decrease her overall stress levels. And what that looks like was not really specified. So although we can't look at a normative population, I think that that would be okay in a situation like this. And then lastly, I would want to do the behavior and thought journal to really look at relevant and accurate contextual information within the client's natural environment. This can really help interpreting the scores that we have from our IRS and the burnout scale. As a self-monitoring tool, it can be difficult to verify that results are accurate. It can also place this additional burden on client. So again, this should be considered carefully. These conversations should be had with the client. But I do think that this was very beneficial when analyzing the specific scores. Looking at procedure, when we were doing our baseline measurements, the client completed Maslow's burnout inventory, 1 academic week of the independent rating scale, and then 1 academic week of the behavioral journal. This was really just to get a good idea as to what her stress scores and thought processes and behaviors were like before the interventions were implemented. Next, the client ideally would have learned interventions within treatment. So these would have been cognitive restructuring techniques, these stress reduction techniques, and specific goal setting and more of like a task-oriented approach techniques. Those would have all been discussed in treatment. Those then would have been implemented, and during the implementation week, outcome measures also would have been obtained. So the client was going to use those techniques for at least one more academic week and was going to complete the same independent rating scale and behavioral journal during that time to track any changes. So looking at our results, here you can see the graph chart for the client's daily stress related to schoolwork independent rating scale. On the left-hand side, we have our baseline. The right-hand side is the intervention. As you can see, those scores are consistently really increasing in a positive direction throughout the baseline. And as you remember from earlier, higher scores did indicate higher levels of stress. During the intervention phase, there does seem to be a decrease in these stress scores, which does indicate that there was a positive impact, possibly from the intervention. We'll talk about that more later. Something else I did want to mention again, though, the Maslach's burnout inventory was taken. However, it was taken only once due to time constraints. But these results did indicate that there was burnout. So again, there's 3 sections. The first section really looked at exhaustion, and I had a score of 15, which indicated a low level of burnout. Section B, which was depersonalization, there was a score of 8, and that was moderate burnout. And section C of personal achievement, that actually was high level burnout. So there did appear to be burnout evident in kind of like my symptoms and what was going on. So that was valuable information to have, especially as we're looking at how stress and these symptoms are related to burnout itself. Here I just wanted to include the baseline qualitative data. So as you can see, I filled in the dates, what I was doing, when I would have certain thoughts of procrastination, those thoughts and behaviors that were associated. The final 2 columns are blank just because this was the baseline week. Here we have the same behavioral and thought log. This is going to be during the intervention phase. So again, dates looking at what I was doing. So if we look at one here, on April 8th, I was sitting on my phone when I realized that I wasn't completing assignment I probably should have been. I had written down that I felt frustrated, and then I decided that I was going to go to the gym to go on a run. After I'd come back from this run, I had written that I felt calm and rejuvenated. Maybe I still didn't want to complete the assignment, but I felt more motivated to do so, and I did indicate that I was able to complete this assignment. So again, as we saw a couple minutes ago, we do see this graph again, and this graph really does show a change for the better in both level and trend. So we can see a positive trend in baseline and a negative trend in intervention, which is something that we would want to see in a study like this. And this really does suggest like an overall improvement in her identification of her stress levels during the intervention phase. And again, as we were using the Behavioral and Emotions Journal, these results were indicated through that as well, because we did see that during the intervention, there did seem to be more motivation. Now, though, whether or not the assignments were completed within the baseline was not tracked, it is evident that it did appear to be less stressful, less overwhelming when the intervention was utilized. Now, just to go over some limitations, as I've said multiple times, there were some serious time constraints here. I wasn't able to obtain significant amounts of baseline data. I also was not really able to obtain data post-intervention. Like ideally, I said before, I would have liked to do an ABA design. I wasn't able to do that. Wasn't able to do the MBI again, which again would have been beneficial to see if that risk for burnout had gone down. And I again was only able to obtain enough data for one graph, which ideally we would really want 2 when we're looking at something like this. Another limitation was the use of the A-B design. Here we really just can't determine if it was the intervention that caused the changes in the client's symptoms and behaviors, or was it some other external factor that was not being monitored. Now, looking at some implications, this study can really allow for having an increased understanding of ways to reduce symptoms of procrastination and stress as we're using both a cognitive and a behavioral approach. Future clients with these symptoms may also benefit from creating an independent rating scale and kind of having their own behavioral thought journal. I thought that this was really effective because it specifically monitored the way that the client was feeling, and was not using a standardized and generic scale. Ideally, the MBI would be administered post-intervention to really increase the understanding of whether or not these interventions simply reduce stress and overwhelming feelings in the moment, or if they actually had an impact on burnout overall. And then, as I noted before, we did see that there does seem to be a high statistic for burnout. So having these effective strategies to manage effects really is critical, as we want to really be focusing on preventative measures to kind of stay on top of these symptoms in employees.